Hello, I'm Dr. Brewer. Ankle pain can often limit your mobility and even impact your quality of life. We want to demonstrate some simple but effective stretches designed to decrease your pain and increase your range of motion. Please be sure to consult with your healthcare provider before starting any new exercise program.
Hello, my name is Craig. I'm a physical therapist with Allegiance Health, and I've been with Allegiance for almost 4 years. I've been practicing as a therapist for almost 25. Today we're going to talk about some things you can do to improve your ankle range of motion, and if we have time we'll go into some strengthening things. These things can help you with your balance and with walking, and then we can go down into some plantar fascial stretches that can alleviate some of that heel pain that sometimes we get. Okay, so the first thing you want to do is talk about ankle dorsiflexion and plantar flexion, which is basically bringing your toes up towards your nose and then pointing your toes down away from you. So just do that, just the basic range of motion, dorsiflexion, plantar flexion. You can do that 3 or 4 times. You're going to get up in the morning. If you have a stiff ankle, just go do that. And then we have what we call inversion and eversion, turning your foot in, invert, turn your foot out. That's an everted motion. And just kind of loosen that ankle up. You can do some circles if you want to. It's all good. Now to stretch the calf, which is made up of 2 different muscles, we call that the gastrocnemius and the soleus. And those 2 muscle tendons combine to make what's commonly called the Achilles tendon. If that gets short on you, that pulls up on the back side of that foot or your heel, and it can cause a lot of tension on the bottom side of your foot. So to alleviate a lot of that tension and pain, let's just stretch the calf. And the gastroc attaches above your knee, so in order to stretch that, you want to keep your knee straight. So I like to do this passively. So you're going to straighten your leg out as far as you can, and if you have enough flexibility to reach that foot, go ahead and do that. Most of us don't. I don't today. So I'm going to use a strap. You put that strap around the ball of my foot, and then I'm just going to sit up nice and straight. I'm going to lean forward with my belly, and I'm going to pull that foot up towards my nose. I feel a little bit of a slight burning sensation behind the knee, and that's about as far as you want to go with this right now. Don't stretch it into pain. You're going to hold that for about 30 seconds, and then you're going to relax it and let it go. Do that 2 or 3 times. Another way to do it is an active resistive stretch, is you pull up as far as you can, and then you hold the strap, don't let it move. Press your foot in like you're pressing on the accelerator of a car. Hold that for a count of 3, and then relax, and then pull back up, and then do that again. Do that 2 or 3 times per foot. Make sure you want to do it on both sides, and then relax. Okay. Remember I said that the calf is made up of 2 muscles, so in order to stretch the soleus, the other one, we have to do that with the knee bent. So we want to take the gastroc out of it and just stretch the soleus, which starts about here and comes down to the ankle. And the same thing, you're just going to pull up, and I like to do this active resistive, so hold the strap, push into it like you're pressing on the accelerator, count of 3, and relax, and then pull back up, and then push into it, and do that 2 or 3 times. Make sure you do that on both sides, and we're all good. That will help. The more you lengthen that calf, the more flexibility you have in your lower ankle and your rear foot, the better your balance will be potentially.